You've already heard that in menopause, women can experience many different symptoms. Of course, you probably know about the hot flashes and night sweats, but there's a lot of other symptoms that bother women, including sleep disturbances, mood disturbances like being irritable or having a depressed mood or feeling anxious, and sexual health symptoms, just to name a few. You might be interested in some practical tips about how to manage these symptoms. For the hot flashes and the night sweats, you can work on cooling techniques like dressing in layers or using cooling or wicking sheets. That may be helpful for some. Using a fan may be helpful for some, but really longer term solutions. The mean duration of hot flashes, after all, is 7 to 9 years, and a good third of women will experience them for a decade or more. So kind of a stopgap measure for the next couple of months may not really last you that long with these longer duration symptoms. Hormone therapy is by far the most effective prescription medication that we have available. Most women who are under the age of 60 years and within 10 years of menopause onset, the benefits outweigh the risks. That is probably something that most women are not aware of. But there's always women who cannot or prefer not to use hormone therapy for whatever reason. And there's a number of other medications, prescription medications that are available to help with hot flashes. One important new one is a drug called fezolinetant, just approved by the FDA recently. This drug actually is a non-hormonal agent and acts in the brain to stop hot flashes where they start, in those neurons in the hypothalamus. Think about what happens with a hot flash. It's sort of a thermostat malfunction. It's like your air conditioner malfunctioning a little bit so that your body is reading that it's hot when it really isn't. That's what a hot flash is. And so this new medication sort of addresses it right at the point where it's happening. But for many of us, getting by with some lifestyle things might be enough. Let's talk about the sleep disturbance. So the sleep disturbance can relate to sweating at night, but it also can just be insomnia. And sometimes those common sense things that we hear about can be really effective for this. In other words, no screen time closer to bedtime, watching the amount of caffeine you drink closer to bedtime, limiting your alcohol before bed, because alcohol, while it may make you sleepy, it really disrupts your sleep during the night. Keeping the bedroom cold can really help with sleep. Another one for mood. We know that exercise helps with mood. It'll also help you maintain your weight and avoid weight gain. But keeping a regular schedule can also help with mood. Eating a healthy diet. We know that gut-brain connection is real. Putting healthy food in your gut helps you have a healthy microbiome and even helps with your mood. All these things can help. But remember, if you're really struggling with your mood, you need to see a healthcare provider because you may need more than just these lifestyle tips to manage that. So in conclusion, there's a lot of things that you can do to help with your menopause experience. But do remember that if you're suffering in any way, see someone who's experienced in menopause management to help you manage these symptoms more effectively.